All right, this is it for chapter 4. What we're looking at here are membranes. Now, a membrane is a barrier. You already know about one membrane. You know about the cell membrane, right? And it acts as the barrier between the inside and the outside of the cell. Now, we're going to look at some membranes in the body that end up being these big coverings. They're going to cover the body, a cavity, a space, right? And what we're going to see in all of these membranes, right, we have the mucous membranes, serous membranes. Let's write this out in case you can't read it. Mucous membranes, serous membranes, cutaneous membrane, and synovial membranes. And when you look at all of these, what we're going to find is that we have an epithelium with an underlying connective tissue, areolar or connective tissue, right? We've got an epithelium, that's just the special name for simple squamous epithelium lining a body cavity, mesothelium, and the underlying areolar connective tissue. Here we have epithelium, areolar connective tissue. Epithelium, areolar connective tissue, right? So when we're looking at these membranes, maybe that's a good rule of thumb, epithelium plus areolar connective tissue under that. Okay, so we know that we have these coverings. Now, the mucous membrane, these are going to be found lining any of our systems that are open to the outside world, right? So the digestive tract, respiratory, urinary, reproductive systems are all going to have mucous membranes. Okay, now the epithelium might change. So for example, in your mouth, you have stratified squamous epithelium, but if you went to the trachea, you'd find that pseudostratified ciliated columnar epithelium, right, but always with the underlying areolar connective tissue. So the type of epithelium in that mucous membrane might change, but it's still serving a similar purpose, right? It's covering that or lining that particular organ. Mucous membranes have to stay moist at all times, and to do that, they secrete mucus. Got it? Mucous membranes make mucus, and that's really going to help decrease friction, as well as in some areas maybe even helping out with absorption. One other thing I wanted to point out, keep in mind that between the epithelium and that connective tissue is a basement membrane, so if you think back to when we talked about those. And I also wanted to point out here, this areolar connective tissue, here in the mucous membranes, they feel the need to give it another name. They call it the lamina propria. I'm fine if you know that it's areolar connective tissue. Okay, so those are our mucous membranes. Serous membranes are going to line these closed internal body cavities. So here's your examples, right? We have the pleural cavities surrounding the lungs. We have the pericardium surrounding the heart. And then all of that ventral body cavity, the abdominal cavity there, is lined by the peritoneum. Okay. Now, one thing to keep in mind when we talk about serous membranes, they're actually always this double membrane. So what we see here is this kind of purplish line around the lung. So coating the outside of the lung, you have what's referred to as a visceral pleura, and then lining the cavity, the outside of the space, is the parietal pleura, right? And so we do that, actually, we use that same terminology. That didn't work. The same terminology on all three of these. They have both a visceral layer. I don't know if I'm on the screen. Let's go this way. Visceral and parietal layer. Again, visceral is covering the surface of the organ. So if this is the outside of the heart, and then there might be this space, and then the other half of the membrane would be the parietal, right? The one lining the actual cavity is the parietal pleura or peritoneum. Okay, these serous membranes, back to that one, these serous membranes also need to be kept moist, and so they produce what's called serous fluid. It's similar, it's decreasing friction, it's a little bit slippery, it's got some proteins and things in there. Okay. Cutaneous membrane is your skin. We'll have a chapter on the integument, so we'll get into this a little more deeply, right? But this is going to cover the entire surface of your body. That epithelium is always a stratified squamous epithelium, but as a membrane, it also has this underlying areolar connective tissue. In the skin, we also, even deeper in, we have this dense irregular connective tissue that we consider part of that membrane as well, right? And so there we go. So basically, from this purple layer on up, that is the epidermis, right? That is made up of that stratified squamous epithelium. And then deeper in the dermis, this is our areolar connective tissue, and even further down all through here is going to be that dense regular connective tissue. The cutaneous membrane makes this really great protective layer. It's thick, it's dry. Some of the secretions you make are actually slightly acidic. It's basically waterproof, right? And so this is going to keep a lot of things out. Our last membrane is the synovial membrane. Now, synovial membranes line joint cavities. So here they're zooming in on the knee. They're showing the ends of the long bones with their hyaline cartilage, right, that articular cartilage. But really we're looking here at this joint space. So they're zooming in to show you the synovial membrane. We have some epithelial cells. This is not like a continuous sheet of epithelium, but there are epithelial cells and our underlying areolar connective tissue, right? These membranes produce synovial fluid, right? Look at this, mucous membranes make mucus, serous membranes make serous fluid, synovial membranes make synovial fluid, and that's just gonna lubricate this joint. It also helps nourish those cartilages. Remember, those are avascular, and so we can kind of squish some nutrients into them. Okay, so those are the four membranes, and you'll see these as you go throughout this entire AMP 1 and 2 sequence. Those will obviously show up in a variety of different organ systems. Synovial membrane, right? So you can kind of see it here lining that joint cavity. Okay, the last topic for this chapter then is what happens when an injury occurred. How does tissue repair itself, right? And so we have a couple things to look at here. And we'll get more into some of these responses in later chapters, like AMP2 has a whole chapter on body defenses, and inflammation is definitely a big deal there. But let's take a brief look. So we have a skinned knee here, right? We have the risk for different pathogens, different microbes, bacteria maybe, to get in. Now that that great cutaneous membrane is ripped open, it's no longer protective, right? So those damaged cells are actually going to release some chemical mediators, a chemical called histamine. And histamine is going to trigger inflammation, okay? And so what histamine does is it causes blood vessels to vasodilate, right, to enlarge. That's going to increase blood flow, right? So if that area ever feels warm, right, it's because you have an increased blood flow. But part of that is it's bringing more oxygen, nutrients to the site in order to help the healing process. The other thing that happens is as that blood vessel dilates, it gets kind of leaky, and that's going to let white blood cells actually leave the bloodstream, come to the injured area, and try to help clean up and remove some of those toxins and wastes, right? The pain associated with inflammation is really as those tissues swell, as they accumulate a bunch of fluid from the leaky blood vessels, that starts pushing on nerves. And so that can be painful as well. Okay, once we kind of move through that, now we're to the point where we want to repair that tissue. But really we end up having two options. Sorry, that's the zoomed in version you could actually read. When we get to the point of repairing tissue, really what we'd like to have happen is regeneration. In regeneration, the end result of this repair process is that you would replace the damaged tissue with a tissue of the exact same type, right? So if we had that scrape to the epidermis, what they're trying to show you here is that that epidermis is healing. Mitosis is taking place and new cells are moving in. So that's regeneration, right? Replace the damage with the original tissue type. Right? And then that tissue is functional. It can do the job it was supposed to do. The other outcome is what's called fibrosis. And fibrosis is basically what you would call scarring. Right? And so what we're seeing here is that once that clot, right, so originally when this wound is bleeding, the blood has to clot to keep you from just losing blood. That clot is going to get replaced with what we call granulation tissue. It's starting to get itself a little bit organized. We see more capillaries coming to the site of that injury. But in this case, what we see happening, right, this is the dermis, so probably some of that dense, irregular connective tissue. It may not actually be able to replace itself with dense, irregular connective tissue, and instead we get scarring. Now, in the dermis, that's not that big of a deal, right? Because, okay, well, I mean, scar tissue is basically made out of collagen, and that's what dense irregular connective tissue was. Maybe it's just not organized quite the correct way. But what we'll see is there's other tissues where that scarring could be really problematic. Picture someone having a heart attack, a myocardial infarction. When that cardiac muscle dies, right, as a result of not getting oxygen, it either has to regenerate or undergo fibrosis. And cardiac muscle is pretty terrible at actually regenerating, and so what it's replaced with is scar tissue. Now, that scar tissue, those collagen fibers, they don't contract, right, like cardiac muscle did, and so you'll start to lose some of that function of the actual cardiac muscle. Let's do this real quick. Let's make a little line here for regeneration. And let's do good tissues that are good at regeneration and tissues that are poor at regeneration, and kind of see where things fall out here. Like excellent regenerators, maybe I shouldn't even do good, let's do excellent. Epithelium, right? Highly, it has a ton of stem cells, it can undergo a lot of mitosis, it's very good at replacing those damaged cells with more cells. Bone, I'll keep as an excellent regenerator. Areolar connective tissue. And then also that dense irregular. Okay, so some tissues are really great at this. Let's do kind of medium good tissues, things like smooth muscle and dense regular connective tissue, right? So tendons, if you tear something like that. Let's call this maybe weak regenerators. We're on a continuum here, weak regenerators. Here I would put things like skeletal muscle And this one's kind of strange, right? It has a great blood supply, but it actually doesn't have many stem cells, right? And so it's not very good. If you tear a hamstring, it's pretty likely that what will replace skeletal muscle is scar tissue, is collagen. And so it's not going to contract as strongly, and it's actually going to be at risk for future injury. And then let's also put cartilage, right? It is not very good at repairing itself. On this end, I have poor, and here in my notes I say basically no functional regeneration. So maybe instead of poor, I'll do that. No functional regeneration. So basically we're saying, okay, like maybe they can make a few new cells, but it's actually not going to work the way it should. What you're going to get here is scar tissue, and the classic examples here, cardiac muscle. So we were talking about the outcomes of a heart attack, and then also nervous tissue, right? If you think about a spinal cord injury, those have a very difficult, if at all, ability to repair themselves. Now, if you think about things that'll kill you, right? Those two systems that do not regenerate well, those are big problems, and those are also really exciting areas of research, right? Trying to come up with ways to stimulate new neurons to develop, right, and repair traumatic brain injuries, spinal cord injuries, and also seeing, right, is there a way that we can actually heal hearts instead of just kind of patching them up with some scar tissue for a little while, right? So you're much happier, right? If you cut yourself, if you break a bone, than you are if you tear a meniscus, right, a hamstring, something like that. Okay, that is it for chapter 4.